so what it usually came down to is, what are you most passionate about within public health, and what are those skills that are transferable across locations? So, for Rachel, the research toolkit is incredibly useful. You can apply that. If Rachel decides she wants to go overseas, she's going to be able to parlay that knowledge and that skill set there. Same thing with Drew and Rory. If it comes to planning, if it's health education, those are skills that are needed throughout the world, right? And what we typically see from public health graduates is that there are these three large domains: the research domain, and then the policy health advocacy domain, and then health education or program planning and evaluation. And each of those three can be applied in a variety of different contexts. So even when you're looking at your MPH program, it's not so important what track you choose. People will say, great, you have an MPH, what do you do? Or what can you do, right? Because MPH doesn't really tell anybody anything except that you went through a program, you've taken biostatistics, you've taken environmental health, you've taken epidemiology, a social and behavioral health science course, and a policy course. Above and beyond that, it becomes very unique in terms of what graduates actually have in their toolkit. So I would leave you with, for my part, that you think strategically about what do you want in your toolkit, because it may be that a master's degree in medical anthropology is the piece that's going to give you the tools that you want. And given the issues of sustainability, ultimately that's what's going to make you sustainable, is that you have a toolkit that you love to use, you're interested in developing, and that can be used across domains, because we're not getting jobs that we stay in for years anymore, right? This is the reality about sort of where the cash flow goes. So that's my piece. I'll leave it there. And please feel free to be in touch with me through Susan, or my office is 312C in Robinson Hall. So I hope you all find your home in public health, because public health needs more of you.
And there's plenty of room.
And there's plenty of room. Good. There's room in the end.
I should add that with that international focus. So I work mostly domestic, but in the time that I have worked in public health, I have been, because of my toolkit, have been offered experiences to go abroad and apply what I teach. So you make contacts, and Rory and I can talk about a little bit, and Rachel as well, in that we're relatively young. And you find your contacts with other young people in public health as you rely on each other to help you support programs, and you just never know where people are coming out. Your network gets very large, and you're very lucky in that sense. So I was very fortunate that just about 6 months before I was about to graduate, a friend of mine had offered me the position to go to Israel and Palestine and work in designing health education for early intervention for pediatrics. Well, there was a lot of bombing going on, and so I wasn't interested in spending a lot of time writing my thesis and then dying before graduation, so I decided to put it off a couple of months. And then I got an opportunity to go to South Africa, and I'm currently in the works about going for a month in December as part of my position and things like that. So that international focus is always there, but it does go down to having the toolkit that you can apply there to being relevant in that experience abroad. So.
Going back to the sustainability piece, I think part of what can make an intervention sustainable in the long run is having policy change. And so this is a hard question, but what's the percentage of your interventions that end up in policy changes, either locally or statewide?
Percentage. I think policy change is often like a lofty goal. So I think that's the end result, and I can give you sort of a more concrete community health example. So when I'm talking about writing grants, I'm not talking about like research projects for the most part. I manage grants for like our WIC, Women, Infant, and Children's Program, or like colonoscopy screening. So my grants are very much health services oriented. And what we're finding is that, have you guys heard about like health navigators, like sort of having someone who can explain the health system in lay terms, like, you know, how do you set up an appointment, what do you need to do before an appointment, what should you tell your doctor, what sort of follow-up steps are there. So at the community level, we know that that really works, and especially for Upham's, where most of our patients lack English proficiency, having someone who can speak to them in their native language and sort of ease the tension of going to seek medical care, because for many people that's really intimidating. That really works. Unfortunately, you can't bill for that. So the projects that are sustainable at the health center are the ones that we can build mass health for. So visits with doctors, and I think, I mean, don't quote me on this, but I know what you can bill for like a social service or a nutritionist visit is very, very small. But we know that that's really necessary. So to me, policy change, now that I'm in this position, I think more about healthcare, which if you had asked me a year ago if I really cared that much about healthcare, no, it's too political, like count me out of it. So I don't think it's something that the health center on its own can change, but like I think together, everyone working together can affect policy. But it's hard because there's a lot of different stakeholders, there's a lot of backstories that you don't really get to know about until you're trying to challenge them. Like, you know, there's people who want things to stay the way they are because it benefits them. So how do you change people's mind and make them think about it from a public health perspective? So I think you should go into public health because we need people like you advocating for policy change. And that's where joint programs like getting your law degree and your MPH could be really useful, because I think sometimes in public health, you don't feel helpless, but you feel like you're every day fighting an uphill battle to get people to sort of see the world from your point of view.
I think policy change, everything I write, because mine can be intervention-based or it will be anything to like produce workforce development. So one of the things that my organization does is that our director helped establish the Edward Kennedy Health Careers Academy at the high school. So we try and bring people into public health at different times. What you really hope for is that everything you do will somehow inform policy change. And what I believe it is I think policy change is when information, like what Rachel does, providing a lot of strong quantitative analysis and proof of something going on with any population meets persuasion, which is, so I pool those two things together to try and inform a decision. But you can't have the persuasive piece without people working in the community health centers to say, this is what I'm watching in my community, and there needs to be something happening there with the support of someone like Rachel who can say, oh no, we have the statistics to track that. Then you kind of pull this more powerful piece forward rather than doing a ton of research and saying, oh, we have the statistics, but we aren't doing anything with it, or we have all this to say, but we don't have the support to back it up. So that's kind of where public health, I think, works the best, is when you're kind of merging those two experiences to further a point, and that's really what needs to happen for policy change.
I'm going to add something for the people interested in international health, especially. Most MPH programs have an internship that you do between your first and second year. Did you guys have that here?
Informally.
Yeah. So when you're looking at programs, if you're interested in doing an internship abroad, it's something to look for when you're considering programs, is to talk to them about what the internship opportunities are and if there's like funding to go abroad. I had friends in my program who, went all over. One of my friends went to India and worked on sort of her own research study and collecting her own data. Another friend went to Africa. So definitely, if you're interested in international health, doing an internship internationally during your MPH is a great opportunity.
Yeah. So I'm in the very preliminary process of looking at programs. I'm a senior, so I'm planning to take a couple years off. I'm just kind of curious about, did any of you take years off for your capacity? Or
I went directly.
Yeah, I went direct.
I took time off, but I was in the Peace Corps, so I was like.
and did you all go part-time or full-time, or what? Did you see any differences?
I went overtime. I don't know what that is.